Ladies and gentlemen, distinguished guests, colleagues, and friends, welcome to the 2017 Jawaharlal Nehru Memorial Lecture. The Jawaharlal Nehru Memorial Trust was founded over 50 years ago in 1966 by Lord Mountbatten, the last British Viceroy to rule India. And Louis Mountbatten founded the trust in order to honor the memory of his rival and friend, Jawaharlal Nehru, the first Prime Minister of independent India, and to celebrate Nehru's contribution to Indian and to world history. The trust was intended to commemorate Nehru and his legacy in two main ways: by awarding scholarships to the best Indian students, affording them the opportunity to study in the United Kingdom, and particularly at Cambridge, and also to hold an annual lecture by, as the trusts put it, a distinguished scholar, scientist, or administrator on Commonwealth or international subjects. In 2015, the trust underwent a change. The scholarship awarding functions were transferred to the Cambridge Commonwealth Trust at the University of Cambridge, and I'm delighted to welcome officers of the trust and also some of our current Nehru scholars who are at Cambridge and are here in the audience. The conduct of the annual lecture was bequeathed to the India Institute at King's College here in London, along with the gift of an endowment to make the lecture possible. And I'm immensely grateful to my fellow trustees and to our president, Lady Brabourne, who unfortunately can't be here this evening but sends her warmest wishes. I'm enormously grateful to them, not just for the generous material gift, but for their faith and trust that we at the India Institute will be able to continue to keep alive this remarkable tradition of public lectures. And what a series it has been. Past lecturers have included Lord Mountbatten himself, V.K. Krishna Menon, one of the architects of India's foreign policy, former Indian President Shankar Dayal Sharma, Prime Ministers Harold Wilson and Dr. Manmohan Singh, Nobel winner Amartya Sen, Sir Mark Tully, the writer Arundhati Roy, Prince Hassan of Jordan, business legend Ratan Tata, Neil MacGregor of the British Museum, and most recently, India's former National Security Advisor, Shiv Shankar Menon. The eminence of the lecturers and the range of topics addressed is, I think, a testimony to Jawaharlal Nehru himself, the single most important individual who shaped the destiny of contemporary India, a founding father who many Indians might today criticize and reject, but whom no Indian can avoid. And at times like these, it strikes me as more important than ever that we need to keep alive not just Nehru's memory, but also his spirit. A spirit of questioning custom and convention, a spirit of making connections across great divides and rivalries, and a spirit of conviction in the power of rational thought and persuasion to move history in directions that improve the life chances of the least powerful. This evening's lecture is the 36th Nehru Memorial Lecture, and I'm particularly pleased that we can hold it today on the 26th of January, which commemorates India's Republic Day, the day on which India declared itself an independent republic. And it's also a day which marks the 5th anniversary of the India Institute itself. And indeed, it opens our own India Institute celebrations for this 70th year of independence. But my greatest pleasure this evening is being able to welcome, as this year's Nehru lecturer, Peter Piot. Baron Peter is Handa Professor of Global Health and Director of the London School of Hygiene and Tropical Medicine. But that's the least of it. He's without doubt one of the most distinguished researchers, practitioners, and policy shapers in global health. Belgian by birth, his work and energy has left its mark right across the world. As a young researcher in Antwerp, he happened to open a small blue thermos which had arrived from Kinshasa, and it turned out to contain what we now know as the Ebola virus, and Peter Piot would be one of its co-discoverers. He went on to become one of the leading researchers in infectious diseases, holding positions across the world, and became a leading figure in the campaign against AIDS. He was the founding executive director of UN AIDS and served as Under-Secretary General of the United Nations for over a decade. And under his leadership, UN AIDS became the main advocate for worldwide action against AIDS. He has, quite astonishingly, nearly 600 publications to his name, 17 of them books, including his gripping memoir, No Time to Lose, A Life in Pursuit of Deadly Viruses. He's held a chair at the Collège de France, is a fellow of the American National Academy of Sciences, of the French and Belgian counterparts of that, a fellow of the Royal College of Physicians. He's been a Time Magazine Person of the Year, has won numerous international awards, and is chair of the MRC Global Health Group and a member of the MRC Strategy Board, among other current roles. And I think Peter himself best captures the range of his work, his multiple incarnations, as he terms them, in his book. And I'll just quote this passage. He writes, "At times I have been an outbreak detective in the heart of Africa, a scientist studying antimicrobial resistance in bacteria on the genetic diversity of HIV, a desperate clinician caring for patients when there was no antiretroviral treatment, a researcher and public health practitioner designing prevention and treatment programs, a UN official leading a complex multilateral organization in 80 countries, a patient diplomat negotiating political resolutions and price reductions in drugs, a stubborn campaigner reaching out to the powerful of this world and bringing AIDS awareness to unexpected places, a frustrated fighter of bureaucrats, an activist from the beginning, and so often all of the above simultaneously, always in connection with numerous other actors." And I think what Peter's experience and work shows is that health is never a local, national issue. It's always a matter global in scope and significance. And nor is it purely a clinical or economic issue. It's an intensely political one, and dealing with crises require the building of coalitions and crafting collective action, a constant search to find that hazy, ever-shifting point where scientific rationality, human altruism, and political realpolitik coincide to bring cure and relief. Peter Piot's global understanding of the issues, though, is rooted also in having had to struggle with them in very local and particular locations, India being one of them. For many years now, from his earlier AIDS work to more recent work on non-communicable diseases, he's been closely involved with India's health policy and its scientific research community. And so I'm really delighted that he's agreed to give this lecture. The title of his Nehru Lecture this evening is Health and Disease in the World's Pharmacy, India. Ladies and gentlemen, Professor Piot.
Thank you so much, Sunil, for this kind introduction, and good evening, everybody. Sunil, when you called me to ask whether I would give the lecture, the Jawaharlal Nehru Memorial Lecture, I thought that was a mistake. You must have taken me for someone else, although we had met before for many times. But since I'm neither Indian, I've never lived in India, I worked really only sporadically, even if I've been maybe 30, 35 times in the country. So I hesitated, as you know. But then I thought, okay, this is a challenge, you know, and it's a great opportunity to, to immerse myself in all things Indian. And we went a few times to, to India, even some holidays, but work. And I read a lot, including some of Nehru's books. He obviously had a lot of time to write some of them when he was in jail. But so forgive if any inaccuracies here. Now today is, as we heard, the 68th Republic Day, when the Constitution came into effect. And I also looked at that, and because some countries have the right to health in their constitution. That's not the case in India. Although there are some articles in the state list that are referring to health and sanitation. However, there are a few articles mentioning health, like Article 39 of the Constitution lists certain principles of policy to be followed by the state, including two that allude to health, and that the health and strength, I quote, of workers, men and women, and the tender age of children are not abused, and that children are given opportunities and facilities to develop in a healthy manner. And Article 47 specifically stipulates that the duty of the state is to raise the level of nutrition, and that's a recurrent theme, and the standard of living, and to improve public health. But the only duty it really specifies is to bring about prohibition of the consumption, except for medicinal purpose, of intoxicating drinks and drugs which are injurious to health. So you see that the current debate on prohibition in some states is definitely not new. Now, as in many political statements of the time and later, nutrition figures predominantly among health concerns. And it's actually the only issue that I would say has made it to the political agenda in India when it comes to health-related issues, which is probably understandable, certainly for the founding parents of the Republic, after the devastating famine, 1943 in Bengal and South India, and also after decades of chronic undernutrition. Now, the last thing I want to do here is to present you with everything that's going wrong in terms of health in India. That could take me for a few days, but prescribe what's a blueprint for how India should improve its health and tackling disease. It would be not only inappropriate, but also I'm not really well placed for it. And I've also witnessed firsthand that it doesn't work in India, and just as it wouldn't work here in Britain. Now, how did I get involved with India? It's a late love and an acquired taste, I should say. I made my first visit to India only in 1992, when I was in the World Health Organization leading AIDS research. And it brought me to the Ministry of Health and some research institutions. But particularly what I remember was a visit to Calcutta, to the Sonagachi district, which is a notorious, let's say, red light district, and which had a big AIDS problem. And because I was in charge of dealing with AIDS, as I mentioned. And I was immediately impressed by really very innovative type of activities, whereas in most countries, the response to the HIV problem in sex workers had been pure a police response, repression. That was part of the response in India also. But in the first place, it was kind of a very truly empowering type of approach, empowering the women who were abused and who had nothing else to do for their survival. And that was really an inspiration for me. And I said, that's the kind of model that we should try to, to bring to other parts of the world, which were done. So that may be a bit strange to say that, but that's, for me, that was a really incredible experience. And it was at the time of an exploding AIDS epidemic in India, but also at the time of total denial in society, in government. We don't do these things, we don't have that. That was kind of the response that I got. Now, much of my subsequent interactions as head of UNAIDS were with NACO, the National AIDS Control Organization, which I must say is a remarkable institution, or was a remarkable institution, with remarkable directors. And it became friends with a number of IAS officers. We had the best of the Indian administrative service there, and with people who later on moved on, like Prasada Rao and Sujata Rao, who both became Secretary of Health, and Y.S. Qureshi, who became the, the chairman of the Election Commission. So people who really had a vision that was going beyond running some disease control program. And that brought me to Mumbai and Assam, the Northeast, Mugawata. I climbed in trucks with truck drivers and visited more brothels and sat down with people living with HIV, visited where people inject drugs and so on. And so on, other side of India than what you would see during most professional visits. But also, it connected me with what is today a real force in the world, an economic force, and that is the pharmaceutical industry. Because when in 1996, it was announced that AIDS is a treatable condition. If you provide it, you give 3 drugs. And we changed completely not only the life and the destiny of people living with HIV, but how we looked at the epidemic. I became obsessed by the fact that this kind of treatment should become accessible to all people who need it. But there was one major obstacle, and that's the price. That treatment costed, that was in '96 when it was announced, costed in US dollars about $14,000. It was in current, the latest exchange rate of the pound, I don't know, it depends on the speeches that are being given, but let's say 10,000 to 12,000 pounds. And that's how I got in touch with a number of manufacturers. In the first place, Yusuf Hamid from Cipla, who had made this also as his mission to provide drugs at affordable prices to people all over the world. And that's a story, I'll come back to that, that has also been a game changer. And then I got into, worked a lot with colleagues from the Foreign Service, in the UN Security Council, in the UN General Assembly, various institutions. Quite a difficult group of people to deal with if you're not on their side. But they're very, very smart, and I got really very respected. And then I also was a co-founder of the Public Health Foundation of India several years ago. Now, after having absorbed what in the beginning I experienced as pure chaos, and I didn't see the system, I must say I came to appreciate the multiple layers, the cumulative plethora of small and big achievements and systems, and a better appreciation for the myriad of small and big obstacles to better health. And it's all like one of these goddesses with so many hands and at the same time moving and all the balls in the air. And to be honest, I kind of like that. My career, as you heard, I lived also and worked in Africa, and the first country I worked in was what's now called Democratic Republic of Congo, which is far more chaotic than India, if you believe it. And so either you like it or you hate it. Now, I could spend the rest of my talk on all the problems and everything that's going wrong in terms of health in India, as too many similar presentations do. But that's not why we're here. I think we're here to look at the potential of the future and to improve health for all Indians. Now, however, I have to start with what is quite a big picture. As everywhere, there are both achievements and many failures, but bear with me for stating a bit of facts, because after all, I'm a scientist, and that's what I like also. Now, the background of population health in India is obviously the fact that the country has more poor people than any other country in the world, more than all of sub-Saharan Africa, for example, and with about 1/3 of the population still living in extreme poverty. And also that there's still rapid population growth in some states, such as UP and Bihar, where health indicators are also some of the poorest. And yet, India is less impoverished than many African countries, but in terms of health outcomes, it fares worse than some of them. And it certainly fares worse than China and its neighbors, Bangladesh and Sri Lanka and Pakistan, and even Nepal for some. So that's something I'd like to come back to. Why is that? And whereas the classic health problems have not yet been brought fully under control, there's really good progress, and new challenges are emerging. Let me mention just 4 of the classic challenges. And the first one, and that I think is really one that is one with long-term consequences and dominating a lot, and that is malnutrition and stunting. Because here, I think India has a real problem still. The good news is that since independence, there has not been a single famine occurring, so illustrating that famine is not only a matter of lack of food, but is, has to do with many policy and other issues. Look at the Great Famine in China, big neighbor, as a result of the great leap forwards of Mao Zedong's. And despite steady progress the last 10 years, child undernutrition rates in India are still among the highest in the world for countries that are not in, outside wartime, with nearly 40% of all children under age 5 being underweight or stunted. Now, it's not that there is the lack of food in most cases. That happens, but many of these children are actually well-fed, but they're stunted because of malnutrition from poor sanitation. Chronic diarrhea caused by lack of clean water, decent sanitation, and good hygiene. So the campaign that Prime Minister Modi just launched, just a few years ago, is totally justified. It's not only about open defecation, but it will have really a major impact, I think, on many aspects. Now, why is malnutrition, why is stunting particularly so important, besides important for the individual? Now, stunting has long-term implications and for individuals, but also for the economy. Children with restricted brain development as a result of stunting in early life are at risk for poor school achievement, low-skilled employment, poor care of their own children, and contributing to the intergenerational transmission of poverty. That's why also it's so important for a society to get rid of that. Secondly, continuing challenges in terms of maternal and child health. India made moderate progress on Millennium Goal 4, that's reducing child mortality, and slow progress on Millennium Goal 5, reducing maternal mortality. But with continuing huge disparity in child health based on social class and among states and geographic location. But there have been real improvements in safer facility births linked to the conditional cash transfer systems as part of the National Health Mission. So their facility births, or births in a health facility, have increased from about 40% to 84% in just 10 years' time. So that's really, I would say, an achievement. Thirdly, there's a continuing problem of women's health and gender inequality. That is not only found in India, it's in the whole of South Asia. And the health and nutritional status of children and women, particularly girls, remain poor, and which puts India near the top of the list for low and middle income countries in terms of poor status. And finally, fourthly, is sanitation. I mentioned it. The World Bank suggests that 1 in every 10 deaths in India is linked to poor sanitation, with 775 million people lacking access to adequate sanitation. That's a lot of people. As I mentioned, over 2 years ago, Prime Minister Modi launched the Swachh Bharat Abhiyan to make all districts open defecation free by the 2nd of October, he's a very precise man, 2019, which is the 150th birthday of Mahatma Gandhi. So currently around 70% of the Indian population living in villages defecate in the open. So a lot of work to do in the next 2 years. Now, on the funny side, as could be expected, the campaign will be satirized in a Bollywood film called Toilet, Ek Prem Katha, which will depict the love story between the owner of a pay-and-use toilet and a girl from the slums. So that's coming out this year, so we're all waiting for that one. But I think that's good, because that's going to popularize this far more than any government billboard. Now, whereas the burden of diseases, of infectious diseases and so on have gone down, new health challenges are appearing as everywhere in the world. And these will probably be far more difficult to bring under control than infectious diseases, since they're far more complex in origin and drivers, and there are rarely unique and simple solutions, which are all grounded in society and behaviors. And let me mention 3 problems. First, so-called chronic diseases such as diabetes, cardiovascular disease, and cancer, they're on the rise in a big way. 60% of all deaths in India now are from chronic disease. Diabetes, disease related to tobacco use, and cardiovascular disease are a huge concern. And then something that's also new, and that is that we still have about 200 million people underweight, and at the same time now 30 million people overweight, obese. not just overweight, obese. And overnutrition is clearly more prevalent in cities, but that's going to be a big driver also of all kinds of chronic health problems. And just to give you a figure, that in urban areas now, more than a quarter of all women are obese, and not just overweight like me, but obese. So BMI more than 30 for the amateurs. And in one generation, the number of diabetics has more than doubled in India to now reach about 65 million people. That's one of the fastest growing health problems, just as here in the UK. So what we are seeing is kind of a globalization of health problems. And whereas we could have hoped that with bringing classic diseases and infectious disease under control, that some countries like India would have been spared the problems that we're struggling with, that's not the case. And because of this growing health crisis, our school has joined the Public Health Foundation of India in a new Center for the Control of Chronic Conditions, and together with AIM, so to develop locally embedded solutions. Second new issue is environmental pollution. That's getting totally out of control. It's been in the news, and it's in the news now and then, but it's not new. I remember more than 15 years ago, I was in Delhi and had to go to a board meeting in the Ashok Hotel with a huge lobby, intense lobby, and I couldn't see the other side of the lobby because of pollution. And last November around Diwali, as you know, the government declared Delhi air pollution an emergency with fine particles, PM2, 2.5 particles levels, more than 16 times the safe limit. And Indian cities are some of the worst performers in the world in terms of clean air, especially in the north and western states. And Gwalior in Madhya Pradesh has the world's second highest levels of particulate matter. And Nehru's birthplace, looked it up, Allahabad, comes in at third in the international city rankings. It's not somewhere you want to be in that hit parade. And a staggering 30% of all deaths in the country now are attributable to the unhealthy environment and cost an enormous percentage of GDP. Thirdly, mental health is also emerging as an issue. I don't think it's new, but it's been highly underreported, hidden, undersupported, and associated with major social discrimination. And suicides, organizations and NGOs, very impressive. I could give examples of everything in any field. Also to hold governments to account. Although they don't always have a direct positive impact on public health. There are also groups that are anti-vaccination groups, and that's also civil society, but for the wrong reason. Let me spend a few minutes now on the pharmacy of the world. Is India indeed the pharmacy of the world, as some have said? And I think it's getting there. In less than 2 decades, India has emerged as a pharmaceutical powerhouse. It's a remarkable success story by any standard. And it's now even, used as a case study in several business schools. Around the millennium, that was not yet the case. And it was driven by a number of factors. One, change in intellectual property laws in India, change in intellectual property laws worldwide, the TRIPS agreement of the World Trade Organization, the fact that the Indian market was kind of saturated, and so the companies wanted to go broader. It was really Indian business going global. And then the AIDS epidemic helped a lot, and I'll explain why. India's pharmaceutical industry today is the 3rd largest in the world. The 3rd in terms of pharmaceutical production by volume, and the 14th in terms of value, because it's a lot is generic. They're the largest providers of generic drugs globally. 60% of all vaccines procured by Gavi, the Global Alliance for Immunization, come from India. And something that I didn't know, and it was a surprise, is that India is even the 2nd largest supplier of medicines to the United States. And that's not so easy to do, because you have to really meet all the requirements of the Food and Drug Administration, and So a major effort has been made in what's called good manufacturing practice and meeting FDA requirements. I visited several companies, both vaccine manufacturers and drug producers, and they are really absolutely up to the state of the art. Now let's see what Mr. Trump will say about that, a lot of the medicines that Americans swallow come from India. Now, I worked myself quite closely with several Indian manufacturers of generic medicines to treat HIV, so-called antiretroviral drugs. And over 80% of antiretroviral drugs today are supplied by Indian pharmaceutical companies. And they brought the price down by over 95%. In the beginning, maybe not always as kosher, but now it's usually in terms of license agreements and all that. And even here in the NHS, I mean, I take statins, and it's a statin made by Ranbaxy in Ireland, an Indian company, and so on. You know, that's globalization, whether you like that or not, but it is an Indian product. So I think in this case, Nehru would have been happy. Swadeshi, self-reliance, totally realized, and even better. It was also under his vision, Nehru's vision, that world-class higher education institutions in the medical field were established. The All Indian Institute of Medical Sciences goes back to then. But it's only very recently that that really paid off in terms of innovation. India's biotech industry is now expected to grow at a rate of about 30% per year. It's enormous. And, you know, we know about from Bangalore and Hyderabad and Cyberabad and in Bangalore, you know, it's IT. But when you go to both cities also, and Hyderabad now has a, what's it called? It's also a whole area, park, where you have pharma companies, biotech, startups, and all that, and there is capital going into this. It's a fantastic business. And it's expected to reach over $100 million in the next 5 years. So, and it's, in other words, it's no longer copying drugs that are made, invented in Japan or in the West, but it's coming up with original R&D and innovation. Last week, I was in Davos at the World Economic Forum, and we launched CEPI. This is the Coalition of Epidemic Preparedness Innovations. What is this? And why am I talking about that? It's a public-private partnership. It includes pharmaceutical companies, big and small, and the Wellcome Trust, the Bill and Melinda Gates Foundation, and several countries. And its mission is to stimulate the development of vaccines where there's no market incentive, like against Ebola, Lassa, Nipah virus, and all viruses you never heard of, but that are important where you can't make money with it. So, but it's those who have the knowledge to make a vaccine, they're not so keen to invest, their shareholders at least, the people working in there, yes. And so that is a real public-private partnership. What's unique about it also, historically, is that for the first time ever, India is a founding member of such a global public-private partnership. Up to now, there was always, you know, some European country, the US, and maybe Japan. First time ever, India. And it's the Department of Biotechnology, and its secretary, Dr. Vijay Raghavan, he is the chairman of the board, and I'm his vice chair. And this reflects both India's ascent as a biotech powerhouse, because also some of the vaccine manufacturers from India are on the board, but also the desire of the country to play a global role beyond classic foreign policy in, let's say, the softer part of globalization. And it's the first time that such, as I said, that such a global health partnership involves India or any other country that is kind of not part of the OECD. Let me now move to the end of my presentation. And the strongest message that I could give is that the bottom line is that India can only fulfill its full potential if it also ensures better health for all its citizens. And therefore, it's quite remarkable that health has not figured highly on political agendas. And even Jawaharlal Nehru spoke widely on education, scientific knowledge, and social reform, all areas very relevant to health, but rarely seemed to address health and disease explicitly in his speeches or writings. Even if in his opus magnum I liked very much, The Discovery of India, there are only, I found a few pages, I think 3 pages, and they're all in this area, and it's about famine and food security and the big famine, and how that was an avoidable tragedy, you know, and linked with British rule. And so that was really interesting to see, and it's kind of a trend in Indian politics, in contrast to some other countries where health is a big issue in elections. Now, India is of course not unique in struggling with poor health indicators. Even far wealthier nations are confronted with it. This one, but last Saturday there was an op-ed in the Financial Times by Bill Emmott, who was once an editor of The Economist. And he stated that one of the big reasons why the United States is doing so poorly on the Wake Up 2050 index of longer-term trends and on productivity growth is non-economical. It is its poor overall health status. Despite spending more than 18% of its GDP on healthcare, which is about 4.5 times more than India, health outcomes in the US are among the worst among high-income countries. So what he says is that the US is throwing away its technological advantage through high levels of obesity and poor health-adjusted life expectancy. And as a side comment, there was in The Economist a few months ago, after the presidential elections in the US, an article that looked at indicators, predictors for who votes for Trump or Clinton, and they found that the best indicators was poor health in terms of voting for Trump, more than unemployment, like in the his body mass index was the best indicator. Now, what's true for the US is actually also true for India, in terms of missing major economic opportunities and development opportunities because of poor health and education and lack of investment in there. So 2 countries with very different issues and levels of development and expenditure on health, I think, are facing similar issues. Now, how can a society accelerate better health? A lot has been written about that, and the work that I would say that's really classic in this area is by Jean Drèze and Amartya Sen, also a previous lecture here, who distinguished 2 types of success in the rapid reduction of mortality. The first one is the so-called growth-mediated process, which operates through fast economic growth, broad economic growth, with an expansion of relevant social services, which, let's say, is the current development in China. And the other model that they found is a support-led process, which doesn't operate through rapid economic growth, but works through a program of social support, skillful policies, and that's been the case in Kerala. Now, in Development as Freedom, Amartya Sen also says that, of course, it's best to have both at the same time, because that's going to give you the more sustainable approach. And that's, I think, would be the best way for India. So you don't have to wait until you're much richer, but you have to work on both the economy and improving health, because they will be synergistic, and there's a whole body of evidence for that. Now, despite many policy recommendations to increase public health expenditure to 2.5%, there seems to be a lack of political will to commit to health. And perhaps what I heard sometimes from economists, I believe that economic gains will automatically trickle down to improve health services. That is actually only true for the privileged, upper class and some middle class, but not for the rest of the population. We have too many examples in history and across the world of that. So that automatic trickling down doesn't work. And yet the health of all Indians can only be assured through a system that weaves together the public and the private sectors, the allopathic and indigenous systems. And this will not only require major funding boost, but above all, strong stewardship at various levels. And early in India's independence, Nehru commented that, famous, it's science alone that can solve the problems of hunger and poverty, of insanitation and illiteracy, of superstition and deadening custom, etc. It's a long speech. And the future belongs to science and those who make friends with science. Of course, as a scientist, I love that. But, and this would make, I was thinking on walking over here, this would make a really interesting conversation between Nehru and Trump, about facts and science. But of course, that's in a surrealistic world, but in reincarnation and so on. But it's an interesting quotation for a post-truth world, and I like that. And the science for health is there and progressing every day, including in India. But Nehru clearly underestimated the importance of major determinants of health. People's beliefs, culture, communities, education. As also pointed out, particularly in highly indebted farmers and young married women are on the rise and under-supported. And I think it was like 2 years ago, we had a meeting here with the India Institute in our school that was discussing that. But with my colleague from LSHTM, Vikram Patel, India has a world leader, if not the world leader, in the field of global mental health. And we're working with King's College, since we're here, and PHFI in finding community-embedded solutions. So overall, quite a bleak picture, not unlike many other countries, but often just worse in any case at a larger scale. Now let me turn to the health system. And the picture there is not much rosier than that of the health status itself. It's a picture of very low government spending, high out-of-the-pocket cost, inadequate human resources, uneven access to healthcare, and an imbalance between urban and rural areas. First of all, India has one of the lowest expenditures on health in the world, including very low public spending. You can't expect miracles with the kind of money that is being spent. As a proportion of GDP, it is now has reached, it even went down, 1.3% only, one of the lowest in the world. The top in the world is the US with 18%. That's equally bad, but this is far too low. And again, no miracles. And the last 10 years, total expenditure on health per capita has actually fallen from 4.5% of GDP to 4.0. And that's a trend that, I couldn't find any other country where that went down. Now, Prime Minister Modi in his election campaign promised a universal health assurance plan, but the annual budget for last year at least slashed health spending by 15%. Now, on a positive note, the increased tax devolution to state governments may offer an opportunity for some states at least to increase investments in health. And fiscal reforms have already led to significant increase in public budgets for health, at least in Bihar and Uttar Pradesh. Now, crucial for people and families is what they pay themselves, so out-of-pocket expenditure. Now, that accounts for over 60% of total health expenditure, which can be enormous and can be catastrophic financially. So it's estimated about 50 million Indians fall into poverty because of healthcare costs. That kind can make the difference between both the poverty line and just under it. And only 1/4 has some form of financial protection. Secondly, there are major shortfalls in infrastructure and human resources that are uneven distributed. You may be surprised here in the UK to hear that India has one of the lowest densities of physicians in the world, with less than 1 per 1,000, but is still exporting. And also of nurses, it's even worse, relatively speaking. It's 1.7 per thousand population. And most of them are in urban areas. When you take that to rural areas, it's much worse. And then we have, paradoxically, with such low budgets, we have also a major underspent. Money is simply not spent in the budget. It's a big problem. There are 2 state-of-the-art public hospitals in New Delhi at the moment that are barely operational because, while the hospital was built, the building is there, they lack basic equipment, beds and doctors, partly because of the slow bureaucratic procurement process. Thirdly, this highly uneven access to care, I mentioned between urban areas and rural areas and variation among states. Fourth, and that's the fact is that most healthcare in India is delivered by private providers. About 75% of outpatient care, 55% of inpatient care. And the growing prosperity of many Indian households is prompting demand for high-quality medical care and increasing private sector participation. And the established private hospital chains from Apollo and others are embarking on ambitious growth campaigns like Fortis and just name it. This sector is of highly uneven quality. It's totally unregulated. And a major challenge is a lack of oversight of standards in the private sector, particularly outside these big chains. And I was astonished to see in a recent study that in rural Madhya Pradesh, only 11% of the sampled healthcare providers had a medical degree, and only 53% had even completed high school. And yet there are also this medical tourism and top quality institutions, all in one country. And then lastly, it would be too detached from reality if I wouldn't mention Ayurveda medicine. And approximately 2/3 of people in rural areas, and close to that also in the cities, use Ayurveda for their primary healthcare needs, either alone or in combination with Western medicine. And since 2014, there's now even a ministry that is dealing with that. But few parts of the Ayurvedic system have been tested in large-scale clinical trials. So I think there's a need for that, and like our school, and we're doing some trials like on yoga and hypertension, and we have here Professor Sanjay, who is dealing with that. Now, why is India performing so badly in health? Because it's doing well in many other areas. And already 70 years ago, Nehru made his famous verdict. India was very sick, both in mind and body. But the body that he referred to was about famine. And an editorial in the medical journal, The Lancet, in 2011 stated that Indian health is in crisis. And I don't think it has much changed since 2011. As I mentioned, India is routinely ranked among the worst performers in health. Even Bangladesh and Nepal are performing better than health on nearly all indicators, despite lower per capita income overall. Let me give just 4 broad underlying determinants. And for understanding health, as we heard from Sunil, is that we must look beyond health systems and biology for an explanation. It's in the first place a combination of social determinants, low investment in health, and interaction with poor social indicators that determine health. Food insecurity, access, clean water, but equally important, if not more important, are income, education, occupation, social status and caste, sex, ability to participate in social networks, I would say culture. And one factor that has been quite extensively studied is literacy. Not just education, but literacy. And literacy may determine poor health in India more than income, although of course they're quite linked. And studies show that a poor district in India can nonetheless enjoy relatively good public health or health of the public if it has a high literacy rate. And literacy acts as a base, enabling populations to understand medicine labeling, access healthcare, engage with public health programs, understand disease. And we were in My wife and I in December were in Kerala, and that's certainly something that we can find there. Quite a poor state, but still good health indicators. And models estimate that for the so-called typical Indian district in the early 2000s, the poverty gap would have had to be reduced by 25% to save 1 child per 1,000 live births, whereas a mere 4% increase in literacy rate would have had the same effect. So that would be a good deal. Thirdly, I mentioned the high levels of malnutrition together with low sanitation, and they're hindering physical and mental development. I'm not going to repeat that. And lastly, the fact that health is a low political and probably also societal priority. Now, the good news, of course, is that not all is negative, and there has undoubtedly been major progress. Going back to when Nehru took over Free India in 1947, life expectancy was only 32 years. Can you imagine? 32 years, that was the life expectancy. That's more than double now. It's 67 years. So that's really real progress and good evidence. The National Health Mission, which was launched, has really made a big impact. And I looked it up, and in 2005, the Nehru Memorial Lecture was given by Montek Singh, who was the vice chairman of the Planning Commission, the former ex-Planning Commission. And he stressed that primary education and health indicators lag behind other Asian countries. And it's in that speech that he announced that a national rural health mission would be established, which then became later on the National Health Mission from rural and included also cities. So the So this speech can be used for setting policy, at least abroad. Now, increase in uptake of public health care roles, deliveries and so on, and perhaps even more important is that the launch of some public health insurance schemes. And now also the mission for a clean India is now also part of it. So that's, I think, is a story to build on. There's also been good progress in some disease control programs, notably HIV, but polio has been eliminated, guinea worm, and yaws. And despite having the world's third largest number of people living with HIV, over 2 million in India, the prevalence is actually only 0.3% because of the huge population. But it's in pockets. But it's a success story. As I mentioned, under the leadership of NACO and then the state AIDS control societies, they've really done a good job, and it's been a rare example also of a joint effort between the union government, state governments, and civil society organizations. That's pretty rare. And I'm not pretending that it worked very well in every single state, but overall the results are there with a major decline in new infections and mortality. And then another aspect that I think is a growing success story, for some at least, and that is world-class tertiary healthcare institutions in the private sector, which can rival much richer countries. Very well known in our field is the low-cost cardiac surgery. Dr. Shetty, the heart surgeon turned businessman. I think he's got now 31 hospitals in India and is now starting also abroad. And it's, I hope I pronounce it more or less correctly, but Narayana Hrudayalaya, it's the Temple of the Heart. And by cutting away inefficiencies to the extreme, he can offer coronary bypass surgery for less than 100,000 rupees. That is already half of what it was 20 years ago in his hospitals, but it's only a fraction of the cost of the procedure here and certainly in the US. And as Dr. Shetty said once, India will become the first country to dissociate healthcare from affluence. Now, let's see, because his clientele in India is definitely not made of the average citizen. But the challenge, though, is now to ensure that all citizens can benefit from this disruptive innovation. The merit is also that it shows it's possible. We have also very widely, worldwide known eye care through the Aravind eye hospitals. They're a great example also, and is another export product. Quality of surgeon to top-tier Western hospital at a fraction of the cost. And as a result, medical tourism in India is booming. And that's becoming a big industry. Here the latest estimates are that medical tourism will be an $8 billion industry by $8 billion, not rupees, industry by 2020. So that's, and that is growing. And finally, I would say something that's close to my heart is that powerful, very active civil society by Manmohan Singh in his Nehru lecture nearly exactly 20 years ago. He said the same thing. And we've learned that good health is not just a biomedical fix, but the resultant of many determinants. Let me now conclude, really conclude, 5 points that probably should be part of the road ahead. First, as I mentioned, and we cannot repeat it enough, that without investing far more in health and education, India's potential cannot be fully achieved. It will require a major boost to the very low levels of public expenditure. And also should aim at eliminating, or at least drastically reducing out-of-pocket payments through mandatory health insurance and coverage. It's very interesting also, when you go into history, that exactly 70 years ago, the Bore Committee issued a report to the government of India recommending a national health system for delivery of preventive and curative services 70 years ago, with a rural focus and publicly financed to ensure all citizens would receive care irrespective of their ability to pay. In other words, something we call today universal health coverage. Secondly, India, the nation, has all necessary assets to accelerate progress in health. That is what I find sometimes so upsetting. It's all there, but it has to be brought together. Effective programs, professionals, etc., innovation, local production. Thirdly, health is generally considered as an expenditure, you know, but the health sector is becoming a major economic activity on the plus side, with world-leading innovation, employment, manufacturing, exports. So it has a huge potential for the country. And it's projected to grow significantly from today 81 billion to 2020, that's just 3 years from now, to nearly 300 billion, fueled by increasing demand, growing middle class, and funded with investments from the private sector. So if that could be harnessed and could be used also as an incentive to broaden that, the benefits of that to all citizens would be great. Fourth, and that is to achieving better health for all Indians, health must finally become a major political issue. Politicians should be held accountable for how have they performed health and a few other social issues. Not just for one particular part of the population, but for everybody. And there is no substitute for public debate and having health on the top political agenda. I also think that the potential and economic and political returns on investment can be very high. But reality is that health is rarely a decisive or even minor issue in union or state elections. On the other hand, we've seen that the strong support for nutritional programs, including subsidies and so on, you know that huge sums are going to that with not always well-evaluated programs, that it's possible to have such a kind of issue on the agenda. So the nearly existential question for me is, what priorities do citizens and policymakers want to put on the health of the nation? Why is this not happening? Because it affects everybody. And finally, in order to get there, this will require a broad front. This should not be a one-party issue. This is about people, every citizen. And not only the public sector, but the private sector, for profit, not profit, altogether. And only such a front, I think, can overcome the lack of trust and engagement between different actors in the system, which I sense quite regularly, between medical professionals, the public, the private sector, drug producers, and so on. And it should also help to overcome inefficient stewardship, fragmentation, corruption, and limited accountability mechanisms. Is this possible? I'm an optimist always, and I believe that at least much progress can be made if the will is there, and again, if it's getting on a political agenda. This is not something for doctors to talk about themselves. I'd like to end with a quote from a paper also in The Lancet by my friend Vikram Patel, a psychiatrist, and an eminent panel from Public Health Foundation of India and the All India Institute of Medical Science, etc., who launched last year a bold challenge to the government to ensure that in 2022, 75 years of independence, that no Indian should be denied their fundamental right to good quality health care due to shortages of services or resources, and no Indian should face impoverishment due to health care. It's as simple as that. Thank you very much.
Thank you so much for that sobering, but I think also very motivating picture which you've given us, which really captures some of the complexity across India, across Indian states and across Indian society about the health issue. It's very striking, as you pointed out, that Nehru didn't really give much attention to health as a policy and political issue, although in his private correspondence he was almost obsessed about it because it was so important domestically to his family members, their ill health. It was something that he was always worried about. And even Gandhi, Mahatma Gandhi, who didn't really think that the state had any particular role to play in the field of health. I mean, it's worth remembering that his best-selling book was A Guide to Health. And it's also worth remembering that one of Gandhi's parting thoughts at the time of independence was his suggestion that the Viceroy's palace, which is today Rashtrapati Bhavan, the President's house, should be turned into a hospital. And maybe if that had been done, that would have been something of a reminder. Of course, none of his Congress colleagues were very keen on that idea. But I wanted, and Peter Piot also pointed something else out, which is true, that these Nehru lectures have in the past, some of them have helped to make policy. And it's certainly my hope that Professor Piot's lecture this evening will seriously be taken by the policymakers in India and will help to shape the next years of policymaking in India. So thank you very, very much for a wonderful and very enlightening lecture from